expressions. Everyone knows Juanita.
Oh, yeah.
Juanita, her eyes each a different color. Her teeth go out and her chin goes in, and her knuckles, they drag on the floor.
And her knuckles, they drag on the floor.
So this is Juanita. She's a 13-year-old spayed female Chihuahua. She presented to us late last week for a 1-week history of neck pain and progressive difficulty walking. When we met her last week, she looked similar to this. She's unable to support her weight. If anything, she's maybe a little stronger now than she was last week, but you see, she drags that right thoracic limb. She's kind of short and choppy in those thoracic limbs. She's holding her head low and she's tense around her neck. So those are all things that suggest a problem in the spinal cord of the neck. She has a heart murmur, and it was known about, but it was a little bit more dramatic than it was last time she had seen her veterinarian. So she wanted to go meet with a cardiologist first just to make sure that she was okay for anesthesia. So we had the evaluation with the cardiologist last week, so we're checking her in today for an MRI. Hopefully the MRI is going to show us something like a slipped disc, and we're going to be able to manage it with surgery, and 95-98% chances that we're going to fix this. So this is a good thing to talk about with anesthesia. It's often someone's concern for their pet of, will their pet do okay with anesthesia, and especially dogs with heart murmurs. And for any dog that is going to get anesthesia, we always sort of weigh the pros and cons, the risks of anesthesia versus the potential benefits of doing the MRI and finding out what we're dealing with, hopefully to find a slipped disc so we can help. So we always do a thorough examination. We do blood work, we do x-rays. So just because you have a heart murmur doesn't mean you can't have anesthesia. We take that into consideration, but we do anesthetize dogs with heart murmurs with a relative frequency, but we're weighing it based off of the severity of the heart disease versus the severity of the neurological symptoms and the likelihood of the tests helping versus the anesthesia harming. We feel pretty strongly, based in Juanita's case, that because 1, she's relatively severely affected, 2, she isn't improving despite trying medical management, and 3, yes, she has a heart murmur. Yes, it's relatively loud, but based off the cardiologist evaluation, it's unlikely that she's going to have a problem with anesthesia or congestive heart failure. All of those things are saying that we should be doing anesthesia today with the necessary precautions. As far as I'm concerned, we can come out and we'll get prepped for a ventral slot.
Southeast Veterinary Neurology is on a mission to help 20,000 pets regain the ability to walk by the end of 2025. It's a huge undertaking, but one that matters. So we're hiring. We're looking for people that are passionate about caring for pets and caring for people. We're looking for people that take their work seriously, but don't take everything too seriously. So if you're empathetic, resilient, a team player, and want to challenge yourself to make a difference in the lives of tens of thousands of people and pets, let us know.
This is Boots. Boots is a 10-year-old male neuter Chihuahua. He came to us on August 31st for vision loss. On his exam, he was blind in both eyes and had absent PLRs in both eyes. He had previously been to an ophthalmologist and his eyes were cleared of ocular disease, so he ended up with us. Started him on a course of prednisone. Dad feels like he's improved in his behavior at home. He's kind of jumping on and off of things, but is unsure if he can see. So he's here for a recheck and an MRI scan today.
She dance for everything. Whenever she's listening to music, it's the same.
Whatever.
Whenever there's a song like I'll start dancing, and like, you know, my daughter dances, and like, no other, whether it's like rap or Latin music or whatnot, but like she and I have like the same moves, and it drives me right nuts. And like Mariana, like, she's like, the only move I've got is this, and she basically does this with her body, and I'm like, you keep those moves
Forever.
as long as you can. As long as you can.
Hi, it's Dr. DiVita. How are you? Good. Boots is doing great. He's awake from anesthesia. Yes, just like nothing ever happened. A little bit sleepy, but otherwise doing well. So his MRI scan, good news is that I don't find anything terribly scary on there. So no big tumor, no big stroke, nothing like that. We did perform the spinal tap as we said. So again, the main things we were looking for were a tumor or a stroke, which we didn't find. Next on the list of possibilities comes inflammatory disease. So things like optic neuritis, which is an autoimmune condition, would be kind of next on the list of things that we look for. That's where doing that spinal tap comes into play. And then the last kind of thing on the list is a degenerative condition, so just kind of aging changes essentially. We did his spinal tap. The preliminary spinal tap results appear normal. However, we do send it to a lab for further evaluation. So, you know, we'll get those results back in about 24, 48 hours. However, with him being on steroids, that can make the spinal tap look normal, even in the face of something like optic neuritis. So at this time, so because the prednisone is the treatment of choice for optic neuritis, you know, kind of, we can't say with certainty that that's not the case, even if his spinal tap is normal today, since he's still on that medication. So at this time, what I'd recommend doing is actually treating him as if he has optic neuritis, because prednisone, again, is the treatment for that, but actually starting a kind of longer tapering course at a higher dose than we did initially. Initially, we started him at an anti-inflammatory dose, but in order to treat optic neuritis, we should give what's called an immunosuppressive dose. So basically quieting down the immune system, because in optic neuritis, it inappropriately attacks the optic nerves, or the nerves that control the eyes. Okay, perfect. Well, we'll see you soon. All right, bye-bye. Based on her exam, based on her history, the concern is for a problem affecting her spinal cord in the middle to lower part of her back, so basically from the shoulder blades back to kind of where the tail starts. And the most common spinal cord problem in dogs is a slip disc, specifically in Dachshunds and other breeds with shorter legs and longer backs. You know, Dachshunds, French Bulldogs, Shih Tzus, they're all kind of our predisposed breeds for slipped discs. Slip discs in dogs are similar to in humans. The discs lie between the bones of the spine, and they typically act like shock absorbers, but sometimes they can kind of get older and weaker faster than the dog does, and that's when they have a tendency to kind of slip out and put pressure on the spinal cord, and therefore, you know, that's when we get kind of interruption of the signals between the brain and the back legs that allows us to be able to move. Next phone call will be after surgery. Surgery does take a few hours, so don't get worried if it's kind of the later hours of the evening before you hear from us. But we'll absolutely call you as soon as we're all done and Bella's awake from anesthesia and kind of tucked in for the evening.
Holy smokes, it's 9 o'clock.